First question you note down, define unit dose dispensing. So that is unit dose dispensing are medications which are ordered, packed or packaged, handled, administered and charged in multiple of single dose units containing a predetermined amount of drug. So actually when you are subdividing your predetermined amount of drug actually into multiple of single units, actually that is called as unit dose dispensing. So small units you are actually dispensing the drugs. Next question will come, what are the benefits of unit dose dispensing? So these are the benefits. No pilferage or wastage should be there. Operational automation possible. So main aim is actually we can avoid the wastage by unit dose dispensing. And another thing is that here actually patient may buy these in less amount. Money may be less if actually unit dose dispensing occurs. So operational automation possible, accounting become easier, paperwork is less at nursing unit as well as all the pharmacy. Then medication errors are reduced, services around the clock become possible, patients are charged only for the dose they receive. So that is the main point actually. Patients are charged only for the dose they receive. So actually the patient actually can take the particular dose or buy the particular dose what they wanted. Better financial control. The third question you note down, that what are the methods of dispensing of unit doses. So there are actually generally two methods. So from there also short question may occur, that what is the difference between central unit dose distribution system and decentralized unit dose distribution system. That is, what is the difference between CUDD and DUDD. So there are actually two methods, that is centralized unit dose dispensing and decentralized or satellite pharmacies. So they may ask you short question, that what do you mean by satellite pharmacy? So in centralized unit dose dispensing, all inpatients are dispensed in unit doses. All drugs are stored in centrally located pharmacy and are dispensed at the time the dose is to be administered to the patient. So the delivery of the drugs to the patient here is made through cards and dump waiter. So you can skip that thing. This point actually, no need this point. So up to patients you can write to the patients. See, in drug distribution system, here I am discussing about the unit dose dispensing. What are the types? So what do you mean by bedside pharmacy? What are the advantages of unit dose dispensing? So here one thing is very important, and that is they may ask you that what do you mean by satellite pharmacy. So that is actually, don't be confused, that DUDD is satellite pharmacy. Okay, so decentralized distribution system. So in final they may ask you that give a short note on satellite pharmacy. So this is actually part one of this chapter. So second part actually we will discuss about the floor stock system, charge floor stock, non-charge floor stock. Okay, so you have to learn. Now here actually you have to learn about the unit dose dispensing. So next part is actually the second part, that is satellite pharmacies for decentralized unit dose system. So here satellite pharmacies are located on each floor of the hospital to operate the DUDD system. So when you are seeing the centralized unit dose dispensing, actually here it is operated from a centrally located pharmacy, but in satellite pharmacy they are located on each floor of the hospital. The main pharmacy becomes the feeder serving of all the satellites. So the main pharmacy actually acts the feeder. From main pharmacy, though, the drugs are going to different pharmacies which are located to each floor. So that is the difference between actually DUDD and CUDD. Okay, and the procedures are actually here. The patient's profile card listing the personal data and disease parameter is easy prepared. Then prescription or medication orders are sent direct to the pharmacist, which are then entered on the patient profile card. Then the pharmacist actually keeps an eye on the rationale of therapy and the drug interaction. So here the work of the pharmacist is to keep an eye that properly the drugs are used or not for this therapy, and how to select. So how to select and avoid the drug interaction, how to select the proper drug and avoid the drug interaction. The dose schedule is coordinated with the nursing station, and medication card is filled for particular doses schedule, delivery after the due inspection. The nurse administers the drug and makes the entry on her records. The card is rechecked on return. The whole sequence requires the availability of the pharmacist for consultation by the medical or nursing staff. Next question they may ask you that give short note on bedside pharmacy. So what do you mean by bedside pharmacy? Pharmacy practiced in the context of hospital seeks to expand its scope beyond the dispensing of drugs by being more and more patient oriented. So actually our aim with the advance of the time, our aim should not be limited on only dispensing or compounding of drugs, but here actually it should be more patient oriented also. So this bedside pharmacy is actually main aim is to gain the patient oriented approach of the pharmacist. The pharmacist no longer functions on isolation, but closely they are interacting with the nursing and medical staff. A bedside pharmacist actually often advises regarding the action and use of frequently used of drugs to the medical or nursing staff. He also gives his own expert evaluation of the prescribed drugs. So during the ward visit, he sees the prescription and the offers advice on appropriate drug therapy. So bedside pharmacy sees the pharmacist as an important member of an interprofession team of the physician, nurse and pharmacist.